Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What are helminths? Helminths are parasitic worms that can infect humans and other animals. There are three types of helminths: flukes, trematodes, tapeworms, cestodes, and roundworms, nematodes. /r/n/r/n. When these worms get into the human body, they can cause parasitic infection, which can appear as intestinal worms or lung flukes. This infection is known as helminthiasis, although it's sometimes called helminthosis or simply a worm infection. /r/n/r/n/Verywell. Jessica Olahrnrn Helminths are most common in areas that have moist, warm climates and poor sanitation. When worms are in someone's intestines, that person passes eggs through their stool. As the feces come into contact with soil, the eggs can spread. /r/n/r/n. People can contract the infection if the infested soil reaches their mouths, often through dirty hands. In the case of hookworm, the parasite matures in the soil and is passed when a person walks over the soil with bare feet. /r/n/r/n. Some people with helminthiasis have no symptoms. However, as the infection becomes severe, people may experience abdominal symptoms, including diarrhea and vomiting. Intestinal worms are treatable. In children, the condition can lead to physical and cognitive growth problems if left untreated. /r/n/r/n. Three types of helminths infect humans. A fourth type primarily infects animals but can infect humans in rare cases. They are /r/n/r/n. People with mild infections of helminths might not have any symptoms. However, if the infection persists, it can lead to more severe symptoms that often include abdominal discomfort. The symptoms of helminthiasis, or an intestinal worm infection, include /r/n/r/n. When helminths infect a person, they can lead to diseases. Although infections are rare in the United States, about 24% of people globally have a helminth infection. The three most common intestinal worm infections are /r/n/r/n. Ascariasis is the most common type of helminthiasis in humans. It's caused by the roundworm Ascarias lubricoides. Ascarias larvae and adult worms live in the intestines. /r/n/r/n. Many people with Ascariasis don't have symptoms, but a severe infection can lead to abdominal symptoms. Ascariasis can also migrate outside the intestines, leading to cough and other symptoms as the worms spread. /r/n/r/n. Whipworm is an infection caused by a type of roundworm. Whipworms live in the large intestine and generally cause a more severe infection than Ascariasis. /r/n/r/n. The symptoms of whipworm include painful bowel movements, diarrhea that contains blood or mucus, and frequent defecation. As whipworm progresses, a person can experience rectal prolapse, anemia, reduced ability of the blood to carry oxygen due to low red blood cells or low hemoglobin, and stunted growth. /r/n/r/n. Hookworm infections are caused by the helminths and Ancylostoma duodenale and Necator americanus. These worms infect the small intestine. /r/n/r/n. Unlike other helminth infections that are passed by ingesting eggs, hookworm is most often contracted by walking barefoot on contaminated soil. Hookworm larvae in the soil can enter the body through the feet and travel to the intestine. After the hookworm enters the foot, a person might experience itchiness or a rash. With mild infections, there may be no symptoms after that. More severe infections will lead to diarrhea, abdominal pain, loss of appetite, weight loss, and anemia. /r/n/r/n. Helminth infection is diagnosed through the analysis of a stool sample. If you display symptoms of a helminth infection, particularly if you have traveled to an area where these infections are common, your doctor will have the lab look for worms in your stool. /r/n/r/n. If you have a worm infection, your doctor will likely prescribe anti-helminthic medications. These medications, including Olbenza, albendazole, and mebendazole, rid the body of parasitic worms. They come as a chewable tablet that's taken twice daily for 3 days. /r/n/r/n 3 types of helminth, parasitic worm, infections seen in humans are caused by roundworms, tapeworms, and flukes. They can cause abdominal pain, diarrhea, bloody stool, and other symptoms. They occur more often in tropical climates where there is poor sanitation. /r/n/r/n Ascariasis, whipworm, and hookworm are some of the more common helminth infections. Helminth infections are treated with anthelmintic medications. /r/n/r/n helminth infections have a strong ick factor. Although it's unpleasant to think about parasitic worms, remember that worm infections are incredibly common, affecting up to 24% of people. Luckily, they're very easy to treat with a 3-day course of medication. /r/n/r/n However, if left untreated, the infection can get worse, so be sure to reach out to your doctor if you're concerned. /r/n/r/n helminths occur most often in moist, warm climates where people have poor sanitation. Because of that, helminthiasis is known as a tropical disease, although the infections can occur in milder areas during warm times of the year. /r/n/r/n Children who are most likely to play in the dirt and have poor hand-washing routines are particularly at risk for parasitic infections. /r/n/r/n helminth infection can be treated effectively with a 3-day course of medications. These medications have few side effects. Although there is less research about natural remedies, there are natural remedies for intestinal parasites that you can try, including berberni, papaya seed, and pumpkin seed. /r/n/r/n Most helminth infections are passed when a person unintentionally ingests helminth eggs. These eggs are passed through the stool of an infected person and can get into the soil. If a person comes into contact with that soil, or food like fruits or vegetables that has touched infected soil, they can contract helminths. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.